Hello. In today's session, I'm going to show you gloPM practice management in a high-level demo situation. So I'm going to go ahead and get started by showing you the dashboard. That's the screen we're looking at the moment. The dashboard actually shows us a home base of everything that we need to know or a place to move around in our system. So it's kind of our gathering place. What you'll notice is that it has patient list information in the center here, along with the patient demographics for any patient that I want to see these two connect. I'm going to start by talking about the very top left of our screen, which is our settings ribbon menu. So if I go to our ribbon menu and I click on edit, for example, you're going to see this is where all of your master files are stored. So things like your contacts, where you build your appointment information from, your billing configuration, and your templates. So it's an area that you will spend time in if you're the person in your practice that actually does any type of master building. Go actually matches our icons on our toolbar, and I'll show you those in a minute, but that's another way to maneuver through your system. And then I'm just going to jump over to reports just to give you an idea that, again, the ribbon menu is really taking you to places that you may have tasks involved depending on your job description in your practice. So you may need to get into some of these items. Otherwise, the dashboard is actually where we maneuver around from for the most part. You'll notice that I have new patient or modified patient, calendar, which will take me straight into making appointments, etc., as well as charges and payments and so forth. So as I go through the demo, you'll start seeing how I move through the system using those icons. The center of our screen is actually where we're seeing the patient information from. So I have the ability to search in code order, which puts them in numeric order, or first name order, which of course will put our patients in first name alphabetical order, or last name order. So I can actually go out here and alphabetize things in whatever column format that I would like to alphabetize them in, or search for them in. I can also just search by starting to spell names. For instance, if I type in MI, it's going to take me to Milton or Mickey's account. Or if I back up and go into just the M's, you can see I have some patients that started with the last name of M and others that had M in the middle initial or in their first name. So it gives us the ability to scroll whichever way we would like to. If I type in MO, it's going to narrow that search down to my Morton Moore as my Mickey Mouse or my James Moore. I can also search by social security number. So if I type in 278, I will see all the patients who have a social security number of 278. I could search by phone numbers. So if I type in 419, you will see all of my patients that have a phone number of 419. I can also search by mobile number. So if you notice that mobile number is an option that's out there as well, I can certainly find patients whichever way that I would like to search for them by. When I have the ability to go by provider, I can actually say, I just want to see all of my patients that are Sean Pham's patients, and then when I'm searching just through that provider's patients. Or I can say I want to see Sean Pham's patients that are scheduled today. So if I click on this checkbox, it'll actually limit me to Sean Pham's patients for just today. Or of course I can go to all patients today, no matter which provider they're scheduled to see. So we have the flexibility in gloPM to search for patients in many ways, which is very much a competitive advantage compared to other systems that have to do a lot of work to get to those search fields. So this is a great feature. I can also do things like, I'm going to pull up Robert. So I kind of had Robert highlighted at the bottom of the screen. You would have noticed that Robert's demographic information is what I'm seeing from here. So I have the ability to show Robert's name, his age. I have days out here because of pediatric purposes, so I have my demo turned on, so if it is a child or an infant that's not quite 1 month yet, we can see things in days format as well. This is all customizable, this particular part of the screen. So when I go into my settings options, I have the ability to say, what do I want to see in my demographics area? So I'm going to jump in there real quick just because I'm on this, and I want you to be able to see that you have the options to say, what columns do I want over here to show up on my demographic dashboard, or what demographic information do I want down here? So for instance, if I am pediatrics, I may not be doing social security number searches. So as soon as I touch on that, it will take that column out of my dashboard. I can also add demographic information. Do I want to see phone numbers, fax numbers, emergency contacts, and all that information right from this area here? All I do is check on them, and then that information is part of my demographic screen and search. So notice I got rid of social security number, and that's no longer part of my options up top. So I just wanted you to be able to see how flexible this information is. The other thing that happens is now that I have Robert highlighted on my account, you can see his patient alerts. And right now you're seeing copay in a flashing red color so that it warns my front desk to make sure that we're collecting all of the copay information that we need to from that patient. You can also add other patient alerts out there on the account as necessary or as needed. The bottom of the screen, this is also related to Robert. So you can see that Robert has Blue Cross Blue Shield of Michigan and Aetna insurance information. So this is where the copay information is coming from. I have the ability to change my copay information as necessary by insurance. One of the things that happens when we start moving into getting detailed information on this patient, I'll just right click to talk about it at the moment, but I can modify my insurance information from here, and that's where I can actually put in the patient's deductible and coverage amount. And I get that information because I click on eligibility check, and this will actually launch me out to Gateway to do an eligibility check for that insurance. The information that comes back is dependent on what the insurance company actually sends out themselves. Most of them do send their copays are pretty much on every insurance, but some of them will go as deep as telling you where their deductible stands and if they're on like a 80/20 policy plan or something to that effect, so that you can maybe collect additional money. But the big thing to know is that they are still on that insurance and what their copays are at least. So that's what eligibility check does. I could also from this area click on prior authorization and grab a prior authorization for this patient. So if this patient is coming in to see us and we have to get a prior authorization from our primary care physician, the common questions are, what was the date of the authorization and how good was that authorization through? So they always have an expiration date. I can say what type of appointment that they're coming in for, if it's driven by appointment type from the insurance company. Otherwise, I put in the alpha number, so it is an alpha or a number field that it gives us an authorization numbers for, and how many visits can that patient come through to see us on that particular authorization, as well as is it approved, denied, suspended, etc. So I can actually put in that it's an approved authorization, and then I can save it, and that authorization is now signed up on that patient. So as I go through my day, I'm going to demonstrate as much as I can and try to make as much sense as possible with sticking with one patient. So on that note, I'm going to say that I want to right click and collect that patient's copay today. So Robert's going to be coming in to see Dr. Pham today, so I'm going to collect his copay. What you'll notice is it launches me into the patient payment screen. So from here I can say what is my check number, and I would put in that it's check number 123 and that he's paying his $10 copay today. So I could as simple as type in the $10 and then I could post it. So I have older dates of service down here for this patient, and I certainly could apply that money at this point, but I'm collecting the copay for today, not for those other dates of service. So instead, I'm going to say I want to reserve the remaining money. So if I click on reserve remaining, it takes me into a notebook where I can say this money is to pay off charges that were posted or that will be posted for today on 222, and then I just throw in my initials just because, but the practices will come up with their own definition of what they want here. The point is that I'm saving money to be posted to a particular charge later on. So it tells me that it's copay or advance pay or other pay, but because I went into the copay area, it defaulted to copay. So I'm going to go ahead and save and close, and then save and close, and that money is now stored out there in an area. When I get ready to do my charges, I can take that money and post it to today's charge. I certainly could have collected additional money and posted that money towards those other dates of service if necessary, but for this purpose I was just showing you how to collect copay and store that money for my charge entry person. On the right side of the screen, you'll see a patient status area. And there's areas that I can certainly manipulate how I want these screens to look, by the way, because I didn't really explain that too much. I can just go to settings and say restore dashboard settings, and it puts things back to the original size and dimension. But sometimes we want to see things differently, and we have the ability to move stuff around and actually completely redesign the screen if necessary. This patient status area that I just started to talk about, once I start checking a patient in, you'll see this grow with all of my checked in patients as the day goes on. Can also right click and customize my dashboard ribbon menu. So my toolbar menu that's up here, I can actually put it in any order I want it to go in. So it's not set. It's again a customizable place. I'm going to go ahead and double click here for a second and get into Robert's demographic area. I said double click because that's how I'm comfortable using it, but I certainly could click on modify patient instead. So both options are okay for you to use. If I'm in the demographic area, what you're going to see first of all is that there is an auto-generate patient code number. And then you'll put in the patient's name and date of birth. There is race out here, and I do like to stop and talk about race for a second. You can add as many races as you want under our categories area. And the idea is that not necessarily for practice management, but definitely for EMR. When you're talking about a patient's diseases or disease management, EMR has the ability to drive demographic or race information as part of their disease management control or case plan. So if I do have some sort of a plan, for instance, maybe a diabetics or other types of disease managements, some diseases are driven by race, which is why we would want to build races and collect that information about our patient. I have the ability to do browsing for photos or do a webcam. So if you do want to put a webcam in your practice, you can do that. The other option that I'll show you when I get back out to the front a little is that when you're scanning the patient's ID cards, you actually have the ability to have an OCR field pick up the patient's driver's license picture and put it in the demographic area here. So I kind of jumped out of order there, but I think you'll get the idea. There's also a zip code format. So if I build in a zip code, you'll see that the zip codes automatically will pull in the city, state, county, and country as necessary. So that's an automatic file that's built out there for you. You can maintain it or build from it or change it if necessary. In the other details area, you'll notice that the provider is the provider in your practice and that there's red asterisks in front of some of these fields, which are telling you that those are required fields. I can also build an occupation. So inside the occupation area are these search menu buttons. If I click on the search menu buttons, you'll notice that it's employer information that's out here as well as occupation. So from the screen you saw before, it stores the occupation information. Again, that helps drive some information for the doctors to understand what it is that this patient does for a living, might also constitute their injury or their care plans. Notice there's employer and place of employment. We get asked about that a little bit, and so I just want to drive home that they could be an employer of GM, but they're working at the Lake Orion plant. So they could work at Walmart, but which Walmart? So it's kind of another way to drive things for collection purposes as well as just reporting purposes and your claim form stuff sometimes. So that's what our occupation button is. We also have Guardian. If I click on Guardian, what you'll see here is that we have Guardian information that we can store for mother, father, or other type of guardian, like maybe the grandmother is the one that's in charge of the child at the moment. Then we can put grandma's name in there. But for, again, collection purposes or follow-up purposes as well as emergency purposes, we have the ability to store multiple addresses that are related to that patient, as well as emergency contact information right here. Guarantors is another area that is the same driver, but the guarantor is the person responsible for the bill. So guarantors are a little bit different, but that gives us a whole nother area to put in guarantor information. I also have an other details box down here, which drives home things like workers' comp or auto claim information and their claim numbers and their injury dates, as well as the statuses of a patient. So if a patient's chart needs to be locked for some reason, or if the patient is deceased and you're driving things differently for whatever reason, you can pick that kind of information up. So on the right side of the other details box is the pharmacy search, and I'm sure through EMR that you're already used to the fact that our EMR pharmacy or electronic pharmacy updates every night. So every single night you get a new list of pharmacies or an added list of e-pharmacies that you can actually scroll through and find. So if I was looking for a pharmacy, I could actually type in the city name, comma, and then type in the type of CVS or Rite Aid or whatever. I can actually find those that way by putting in city, comma, and then the name of the store is probably the easiest way to scroll in the pharmacy area, and it'll get you there much faster and better. I also have the ability of adding referring physicians, and notice that when I go in here it is a checkbox. So if I have more than one referring physician, all I have to do is check on those boxes and then save them, and then I do have multiple referring doctors out here. This carries into EMR as well, so when we're sending out our documentation to our referring physicians, that we are hitting all of the physicians that need to be that need documentation from your provider. So, for instance, your endocrine and your cardiologist might need information for your visit today. So if I go to primary care physician, that's obviously a different field, and you can only have one primary care physician, and they are the ones that are responsible for getting you your prior authorizations, so you want that to be separate as well. I can put down what location the patient primarily is seen at, so you will build your own location names in there. And so I just, for sample purposes, did main office, remote office, and maybe a hospital. But the idea here is that the patient normally is seen at our remote office, and that becomes our default. Our insurance information is added from here as well. I'll jump in here real quick just to give you a quick idea, but this is where I can actually modify my deductible and copay information as well as my coverage percentages if I wanted. I drive whether it's their primary, secondary, or tertiary insurance, and we do have the ability, which is another competitive edge, to have more than one primary insurance information on a patient. For example, if a patient has workers' comp and commercial insurance, I need to drive both of those as primary and then pick from charge entry which claim am I dealing with today. So it makes it very nice and very easy to maintain without having to have multiple patient accounts out there. One of the things that I really like is this exempt from report and exclude from statement options at the bottom as well. When we have I'll call them dummy patients, but when we have fake patients like Mickey Mouse or training patients, when you're training your staff, you tend to go out here and test things and train things by showing real IC9 and CPT codes, which of course is your diagnosis and procedure codes. when you're doing that on a patient, you're multiplying units, you're putting in real dollar amounts, and all that information actually goes on your productivity reports. So we have with as quick as the click of a button to say exclude our training patients from our productivity reports. So it's that easy to make sure that you can go ahead and have training inside your real database so your staff is actually learning appropriately and not have to do any type of manipulating on your month-end reports to get those training patients out of your productivity reports. So I think that's a real big competitive win right there. When we go into this demo history, this is another area that's really big that a lot of other softwares don't have. When I click on demo history, it'll actually show you any changes that we've made on this patient's account. So it'll show if we've changed their last name, first name, middle initial, addresses, any of the information on there. So it's a great record tracker. So if we change this patient's name from Robert King to Robert Kingsley, and then do save and close, the next time that we go in there and hit demo history, you'll see that his last name was originally set up as Robert King, and now it is in the city and state that he was at was also changed because I put in that new zip code. So it's monitoring and keeping track of everything we're doing. At that point, it is not showing you who made the changes, it's just showing you what changes were there. And just because I was talking about tracking changes, I will show you real quick right now that under Reports Audit Trail, I can actually do from here, it's telling me who's modifying the patient information. So you can actually see what has been done and at what point it was done. So our audit trails are much more detailed in the regular audit trail than in the demographic history. But yet we do want to know what their old address and phone number used to be, so we aren't resending statements to old addresses or something to that effect when you're dealing with collections. So I started to show you based on Robert's account, but I do want to go in to show you maybe a couple of others just to give you an idea that we can do things like store insurance card information out here for a patient. So it'll scan their front and the back of their cards if necessary. I can also go in to show you that on Rosie's account we can put in pictures and separate insurance cards. Because it's a demo database, we don't have real driver's licenses in here right now, but I do want you to know that that ability is there and pretty easy to do. So this is a really nice feature for billing purposes to be able to actually read the right numbers and know the phone numbers, etc., to follow up on. So just wanted to get you back into that a little bit. I'm going to go back to Robert's account. So Robert now has an appointment. So I'm going to kind of jump over to the look and feel of the Microsoft Outlook process, which is what this area here is representing to me anyway. I have my mail and appointments, my calendar, my tasks, which is very similar. So just out of habit, this is where I go into the calendar all the time. It's just where I spend most of my time. But there is also the radio button at the top in the toolbar for calendar. I'm going to double click on here and go into the calendar. And I have this set up today to demonstrate 3 different ways. So I have Dr. Lance Plastic, Dr. Norman Peed, and Dr. Sean Pham showing at the moment. Dr. Lance Plastic I have set up with what we'd call a predefined template. So his appointment templates are set up to say, I only want to see new patients at a certain time of day. I only want follow-up appointments at certain times of day. Or urgent care. So they can actually take whatever appointment types they want and create them into a template, a pre-formatted template. Or like Norman Peeds and Sean Pham have out here is they can just tell the staff, you know how long my 10-minute appointments are, 15 minutes appointments are, just fill my day up the maximum that you can without setting a predetermined template. So On that note, on the left side, I'm going to show you the providers. And if I click on these providers, you're going to see multiple providers show. So if I do have many providers in my practice, I can actually show as many as I would like to show. Or I can certainly shut them off again and only see certain doctors at a certain time. I can also book resources. So my example of a resource is a casting room. Other resources could be things like ultrasounds might be a resource that needs to be booked. A nutritionalist in the office may be a resource that you might be booking at the same time as a doctor. So this is all concurrently being booked, and that's why when I clicked on it, it became a calendar or a schedule that I can schedule at the same time. So just realize that resources can be used from anything from a machine to a room to a person. So whatever it is that makes sense to the practice. Under location is where we can see our patients from. And then at the bottom is color-coded legends. And I have a lot of appointment types out here because I demo to a lot of different specialties. But realize that you would probably, as a practice, only have a few appointment types that make sense to the type of appointments that you use in your office. So I'm going to kind of come back here a little bit and talk about the different ways I can move around in my system. So I can actually take this patient, and they called in and said, I cannot be seen at 9:30 today, I'm running late, can I still come in? Sure, you can come in at 10 o'clock. I can just drag and drop that appointment, and it moves it right into my 10 o'clock appointment slot. So it's that easy to move an appointment around. I can also click on it and just drag it to be a bigger, let me try that again. I can drag it to be a bigger appointment time. So we realize that this patient might need a little more time because maybe they're handicapped or have something that needs to be addressed that's taking more time. I can just drag and drop that appointment to a bigger time slot. I could have also double clicked on it and just changed my duration right from here. So I just want you to see that there's multiple ways of doing that. Not only can I drag and drop them from one appointment to another, but I can go from one doctor to another or even one day to another. So it's that easy for me to manipulate my calendar. This is a huge competitive piece for our practices. So they usually have to do a lot of jumping through hoops in order to get things scheduled out there. So just wanted to point that out as well. I'm going to go ahead and make an appointment for Robert. So if I right click in an appointment time slot, it'll offer me to do a new appointment, or if I was adding a brand new patient, I could do that, but I'm just doing new appointment right now. So as soon as I do that, it knew that I had Robert's account out on the dashboard, so it knew that that was the patient I'm scheduling for. I could have also certainly clicked on this button here and went to my entire database and searched for my patient that way. My referring doctors automatically carry in from his demographics, as well as if I wanted prior authorizations, I could do that. I can pick which location I'm scheduling for today. So normally he's seeing at our remote office, which is why that defaulted there, but if we're scheduling him today at the main office, I would certainly change that. We also have departments, and I don't have departments created in my system, but a practice may departmentalize. For example, physical therapy might actually departmentalize what part of physical therapy is that patient coming in for today. Is he going into the pool, or is he going into the gymnastic area, or is he going into another part of our office? So physical therapy ends up having different departments inside them, and they might want to departmentalize their appointments as well. Under type, this is where you set up your appointment types. So if I'm going to say that this patient's coming in for a follow-up appointment, it knew that the follow-up appointment was 10 minutes and that we associated that as a color yellow. And just to show you a few others, I can go ahead and put in new patient and what the duration is and what the color is. Your practice actually designs those as part of their setup. So what is the patient coming in for today? I can also say from here what the problem is. So we could say fever, chills, dizzy. So we can put in different types of information if we want right into the notes area, and that stuff can carry over into EMR for us as well. I could save and close this appointment right now, but before I do that, I'm going to finish talking about our problem type and our resources. So I had mentioned resources earlier, and if I wanted to schedule this patient to have the casting room, then I could just search in here and say that I'm scheduling a resource at the same time. I also have the ability to pre-build problem types. So if we are a specialty that has specific types of problems the patient comes in for, we can pre-build that information and it would automatically pop up in here and carry into EMR for us as well. I'm going to click on resource and talk about resources for a second. Up here, it knew that I was sitting, or that the common way to sit is in a 15-minute duration appointment time slot. So it kind of takes that information automatically. I can say that this patient is coming in on Monday, Wednesdays, and Fridays. So if I do that, I can actually pick for how long, and we can say that this patient's maybe under therapy treatment until the end of March. And then I can click show, and it'll show me any appointments that I want to book this patient for. So on Monday, Wednesday, Friday, Monday, Wednesday, Friday, Monday, Wednesday, Friday. If I hit apply here, it would actually make the appointment for this patient going all the way out into the end of March, as I had picked here. So I don't really want to do that at the moment, so I'm going to close. Excuse me. And then I'm going to go ahead and just save and close that appointment. So this is telling me that this patient's already scheduled for the selected date. Do you wish to continue? And I'll say sure. So that's just because I'm in a play database, but most of the time your practices would be grateful to know the patient's already scheduled in here. So it's a good thing. When you hover over them, you'll see that it shows Robert's account as the sick call, fever, chills, and dizzy, and then it shows their appointment type. So you can actually kind of see what's going on with that patient as we're going. If I click on it, on the bottom left-hand side, it also comes up showing you things like their phone number, the location of the appointment, etc. So it gives you a little more information as well. So scheduling is pretty easy to do. It offers you an abundance of choices and of course the flexibility that you need when you're in your office. So back to talking about the pre-designed templates. In the pre-designed templates, I have it set up to where all of my open appointment times are set up as white. But I certainly could click on this show templates in color button and have it color coded if that's something that your practice would rather see. Personally, I like to see it in white and then see my appointments that are scheduled out there in color. I have the ability too to see, do I want to see the templates or do I want the templates hidden? So when I click on the hide template, it actually just shows me appointments that are truly scheduled compared to showing me the template where I would be booking them. So if I was demonstrating to office manager or to a front desk or a call center person, I would be showing them the pre-built template. But if I was the doctor, I wouldn't want to see that template all the time. I would just want to see my appointments that are out there for today. So I would probably set my default to be hide template, where somebody else might set their default like it is today to say show me the template. I have the ability to see, of course, by day, which is what we're looking at now, or by week, or even by month. So I have the ability to see my calendars in many different ways if that's you know, an easier look for people and how busy they are and how far out they book their appointments. On that note, I'm going to talk about searching for appointments. So if I click on search, it takes me into a search screen where I can say I want to search for Dr. Lance Plastic for new patients at my main office. And then when I click the search button, it's going to show me a calendar that I can now book a new patient. So if a new patient is calling and said, I'd like to come to your practice, how far out are you booking appointments? Then I can just double click from here and book it. I also have a recurrence pattern down below. I can look for or search recurrence patterns the same way that I did in the last screen. But this way, if I needed to search for or book certain appointments at one time, I can grab them and certainly schedule them out. I'm going to go ahead and close from here and then talk about our next search option. Our next search option is actually done through follow-up. So if my patient is checking out and my doctor said, I would like to see this patient in 3 months, then instead of clicking the original search area, I would actually click on the follow-up button and say for 3 months. Now, mind you that right here, this is all customizable. You, as a practice, determine what follow-up you would like to see. As I click on the 3 months screen, what it did is it threw me out to the doctor that I had highlighted, and it automatically knew based on my setup what appointment types I consider follow-up appointment types, and it gives me that information. It also took me right into the time frame that I wanted it to go into, although my hand just dragged across my screen and went farther than it was supposed to. But it took me right into May, into this particular week of May, because it knows that that's the date that I'm scheduling 3 months out from. Today was 2/22, so it's taking me out to May 22nd so that I can start scheduling follow-up appointments from there. So it's just a quick launch for my checkout to say when are they coming in 6 months, what's available, and then what's not. So it's that easy for me to create follow-up appointments. I can also click on print preview. When I go into print preview, I can do it by doctor if I want to, or I could certainly see separate doctors, but I'm going to go ahead and do a generate report. And maybe I won't. Let me get back out here so I can see what appointments I have going. I don't think Dr. Lance Plastic is my doctor I want to see today. So for some reason I got on Sunday's date there. It must have just been my hand dragging across my screen, so I apologize. So let's try it again. We're going to go into print preview. And if I paid attention, I would know better. So under appointments here, it's showing me the appointments that I have scheduled out here for Dr. Norman Pede today. I can customize these by either quickly getting to them by today, tomorrow, yesterday, this week, last week kind of information. I could also customize by putting in any date ranges that I want to here, or up in the patient area, which I think is really slick, is I could put in one particular patient's name here, and if they do have multiple recurring appointments, I can get it to show me all of their recurring appointments and print this off to give to the patient as their own reminders. So it's a nice feature that I don't think many other practice management systems offer. So that was a very good piece of material there. The other thing I can do is what we call zoom time. I have my system set up to see every 15 minutes, but if your practice is one that actually books maybe every 5 minutes or something, you can click on that 5-minute area and it's going to take you into the every 5-minute screenshot here. So it's a little bigger if that's something that is easier for you to read or something that you would like to read. You can drive your zoom time to be whatever you want in your practice. I usually leave it at 15 minutes because it's pretty standard for Outlook and how I'm customized to looking at things. So making appointments or scheduling them is all pretty easy. I can also check a patient in. So that's kind of my next move. So we kind of showed you the screen, showed you appointments, how to move around, and how you can pre-design stuff. I'm going to right click here and say that I could mark Robert as a no-show or a cancel, and of course we'll be able to get reports out of the system that will tell us how many no-shows or cancels do I have in a day, etc. I can also come down here to templates. Our templates are driven off of Microsoft Word, as you all know from EMR. So I'm just going to kind of show you a few things here, but our SOAP notes are really our templates that our doctors use when they're documenting their exams, as well as I can get any type of report information I want, referral letter information, etc. But I'm going to really concentrate on my check-in for the moment. So I'm in check-in and I can pre-set up any check-in type of templates that I want built in Microsoft Word. So I can build my own encounter forms, I can have face sheets, HIPAA forms, financial forms, new patient packets, receipts of any sort that you can drive from, waiver of liabilities, consent forms. You can really pick just about anything that you want there. So I just wanted to talk about that from the outside, but I can also right click, and then when I do check a patient in, one more second. Before I say check in, notice that there's a task down there. I could actually go to task and say, this patient is coming in for a follow-up visit for labs or tests, maybe an MRI or something. And there's nothing more annoying to a physician than a patient sitting in their room waiting for test results, and we don't have those results in our office yet for some reason. So you could actually pre-design a task so that you can make sure that if they're coming back for a follow-up for a read of some sort, that we actually have that information in there before the patient comes in. So tasking can be used in multiple ways, and I just like to kind of talk about that one right here. When I click on the check-in, this check-in box is actually driven for us to do everything a check-in staff should have to do. They could get their prior authorization from here, or they could launch out to eligibility. Normally that stuff is done ahead of time, but just in case this is a walk-in appointment or somebody who is giving us new insurance information at the time of check-in, I can certainly do that from here. I also have my templates that are stored out here, and so my example a minute ago was to say I need to get a HIPAA form off for this patient and a face sheet, and I want to get maybe an encounter sheet. So I can certainly, just by checkboxing those, get those to print. As soon as I hit save and close, my system would automatically print those to my default printer, or it would take me into the printer area to say which printer do you want it to go to. And that's all a setting that you determine. So the idea here is that a patient, when you go into the doctor's office, sometimes you're given 6 or 7 forms to fill out, and that patient has to fill out their name and address and information on every single piece of paper because they're blank. Where here, the information that we have is going to automatically be populated onto that template, and so the only thing the patient has to do is truly sign it or fill out the information that's necessary for them, but not all that typical data that you already have in the system. You'll also see their past billing information and any past balances so that you're collecting money ahead of time. So if you're going to schedule a patient, you can say, you still owe us $100 from your past visit. Please plan on bringing that money with you at the time of service. And then this is a reminder here for the check-in to say, oh, that's right, Mr. Jones, you still owed us $100 from your past visit. Do you think you could pay for that today and collect that money? So it gives us the ability to launch out for authorization, eligibility, any type of templates, and then billing information as well. So I'm going to go ahead and save that and check that patient in. And so now what you'll notice is that when I right click, check-in is ghosted out and checkout is there, so the patient is in the office. If I close from here and go out to my patient status, you should start to see now that the patient status is that he's checked in, and as he checks out, he'll fall off of there. So that just kind of grows as the day goes on, comes and goes with who's actually checked into your office or not. So that's actually showing you pretty much everything about the dashboard and modifying patients and then doing appointments as well. So the next section is going to be charges. So this time, if the patient's coming in, hopefully the nurse has picked up the patient and taken him back into the room and did their vitals and their chief complaint and their histories on the patient. The physician then picks the patient up and does the physical exam on the patient and turns around and sends that data back into our charge entry window. So through EMR. So I'm going to click on the charges button for a minute, and I'm going to talk about 3 different ways to do charges. And so the first thing, it's going to take me a minute to explain to you the screen and the setup, but then I'm going to explain to you the 3 ways of doing charges. The first way is going to be what I call the long normal way, which is what most billers are used to, is the manual process. So you'll see that Robert's still up on my screen because he's still on my dashboard. On the far right hand side here, we have a close date and a charge tray. So these close dates are actually driven for balancing purposes. So that's how I close out the end of my day, and then of course eventually the end of my month and the end of my year. My charge trays, I can actually build as many charge trays as I want to help me balance. So if I'm the checkout, I probably have daily charges, but if I'm a biller, I might have daily charges as well as I might have surgery charges or something else that I might be charging out. So you can build these charge trays, and they obviously connect by the user as well for balancing purposes. So it's a pretty nice option there. On the right hand side here, it automatically generates a new claim number every time that you go in to do a new charge. I have my facility, so what facility are the charges being rendered from? My billing provider, notice my billing provider here says gloSample provider, but my provider on the line item is Sean Pham. And that's because maybe Sean Pham is a PA or a nurse practitioner or some sort of an extender that we have to bill out under a different billing provider. We have that ability, so it's just demonstrated to you like this so that you can see that. I also have referral providers, so that's the referring doctor that will go on my claim form. If for some reason I don't want the outside referring provider and I have to use my own provider, I can click on same as billing provider, and it puts in that my billing provider as my referring doctor, or ordering doctor is normally how that's mentioned. My prior authorization number, so if I click on that, we did grab a prior authorization earlier for this patient, so we can certainly grab that prior authorization and put it on today's charge. I also have the ability to have multiple fee schedules. Now, the majority of our practices all do physician billing, which is considered non-facility charges, compared to like ambulatory surgical centers or hospitals that might do facility charges as well. So we normally default to the non-facility charges, but I can have multiple fee schedules, and I only have a couple samples out here, but realize that I can build fee schedules that show me my allowed amounts by insurance company. These are all importable from their website. So really we go out to Medicare's website and pull in by locality your particular Medicare fee schedule, or Blue Cross or any other HMOs or PPOs that you belong to. All we really need is them to be in an Excel format, and then we can insert or import them into your database automatically for you. The next section is workers' comp or auto claim information. So if this is a workers' comp insurance, then obviously you would want to put in their onset date, and then their workers' comp numbers will show up here, as well as pull in their injury date information. And then of course hospitalization information, or if you're performing as an outside lab, but you collect part of that information, then you can store that there as well. On the left side is my insurance information. So I have my insurance party 1, 2, and 3. So this is showing me who my responsible party order. For some reason, if this is wrong, I can literally just change those numbers and it'll swap them to go from one party to the next if necessary. But I'm going to show you by date of service down here. So if I say that I'm posting a 99213, you'll notice as I'm starting to type in those numbers, it's finding all of them until it gets narrowed down to the one that I want. I could hit enter or double click. I can also type in a number. So if I know my diagnosis codes, I can obviously just type them in, or if I don't know, I could actually start typing in alphabetically, information here. So it's getting to my hypertensions as quick as by spelling it out or by numerically putting it in. It's the same way in the CPT area as well as your modifiers too. So just to let you know how easy it is to get that information. I have buttons here to add a line, so if I wanted to go add my second line I could do that, or there's an F2 hotkeys down below because most of the time billers don't use their mouse, they want their hands right on the account so that they can start putting in codes. Let me try this again. So as I start to put in my CPTs, it automatically pulls that information in. I have up to 4 diagnosis codes on the screen at the moment. That is going to be changing, and electronically we'll be able to send more as well as following some other rules. But the general is 4 diagnosis codes because that's all that prints on the CMS form. And then this is actually drivers to say, maybe I just want to add my next diagnosis code here, but I only want the one diagnosis code to go on my claim form. Then I have the ability to control this, the information from these buttons here. I could also have pre-built charges into my system, or if I needed to, I could certainly type in my own charge and override that charge, realizing that my allowed amounts aren't out there if I don't have them pre-built into the system. But most of the time, our practices do pre-build that stuff in. This is where our modifiers are, so I could certainly type in different modifiers if I wanted to. You'll see that we have the full range of modifiers added out there for you, and of course that just started with the 2, but there's a bunch out there. So I have the ability to say, do I want allowed amounts to show up in my charge entry screen? Or do I want to put charges on hold by any means? If I do, I can put the reason why they might put it on hold right in here. Or I also have a place of service if that's something that is important to me to have a charge entry. And then the last one is our CLIA. So if you need CLIA by line item, then we can actually have a CLIA number box show up out here that will pull that information in from your location storage area where your CLIA numbers are stored. But I like to talk about them here just in case that's something that that you need that you didn't see. So again, this was the long manual way of putting in a charge. So I'm going to go ahead and hit close from here, I think. Trying to decide how I want to show you. I'm going to close and say no to save charges on that record. Then I'm going to go back in and show you the next way. So the next way, which still is not my preferred way, by the way, it is by doing smart treatments. I really, really like smart treatments, and in a lot of cases, if our doctors are not finishing their notes before our patient is done today, then smart treatment is another great way for our billing staff to get information documented in here quickly without having to put in every line item individually. So if I hit on smart treatment, what you can see is I can say, well, this patient's coming in for a Department of Transportation visit. And so I can pre-build different types of treatments that we do. And as soon as I hit select, it automatically posted all of the procedures that we do when we see a Department of Transportation patient and we do a complete physical for them. So it'll pull in all the information that they need, and then I can just save. So it's that easy to pre-build stuff that we do on a regular basis. So just to show you another example, instead of DOT, if I was doing a child and we did these series of immunizations, of course it didn't like that because I was already booked, so let me get out of here. And do smart treatment, and this time instead of DOT we would pick immunizations, and then you would see just the immunizations that are done and the vaccines that go along with them. So you can actually connect different diagnoses to go with each vaccine individually, and it knows, and it'll stay out there forever. You could also create your modifiers to go right along with it if necessary too. So I just wanted you to see that via smart treatment, it's a very quick way to get bulk charges applied for something that you do routinely. Of course, we do it routinely, except for today, we didn't do this particular patient. So I could just hit my F3 button to remove line, or up top my remove line. So whatever way I want. And then I can say, yes, we're not doing that one today. So even though it's normally what we do, but today we weren't able to do one injection, you can just remove that, just as simple as that. So that's another wonderful way to get charges done. So then the last way of doing charges is through EMR treatment. And I kept closing out of there on purpose so I didn't save immunizations on an adult patient for my demo purposes. But certainly if I would have hit save and close, I would have stayed right in that charge screen and would not have to be coming back in there. So my last way of showing charges is EMR treatment. EMR treatment is incredible, comes straight from the doctors. So I actually had the doctor document Dr. Robert's account earlier today. So I'm going to double click on that. And what it did is it pulls in the office visit and the charges that the doctor has done on that patient right from EMR. So if I had charges out there on those particular codes, then they would have certainly showed up here. So it's that easy. I can say, oh, wait a minute, he did something, but I need to know, was it the right side or the left side of the body, or add a modifier of some sort. So I'm not really sure the doctor forgot to send that over to me. Realizing that modifiers and units are also designed through EMR so that the doctors could certainly send that information over. But sometimes they forget. So as a biller, I would click on load exam, and that would launch me straight into the exam that the doctor did on that patient today. So I could quickly identify and see what the doctor did and then close out of it, finish my charge, and I'd be done for the day. So the load exam actually takes the exact chart note that the doctor just did in EMR and shows me it. So I don't have to go into EMR and find the patient and look for the right data service and then open it and find it. It just automatically launches me there. So as soon as I hit save, it'll take me straight back into my EMR treatment area so that I can grab my next patient. So I can double click on my next patient. It pulls those charges in, and then I would hit save and so forth, and it would just go right through my whole process of the charges that are sitting out there in EMR treatment. So charges can be done in 3 ways. Just to kind of wrap that up, I can do it manually by putting in each line item individually. I can also do it manually and have some preset things. So if I know we always have modifiers that go with certain charges during the setup, I can build it that way for any of these options. And then I have EMR treatment, where I can do bulk setup of things that we routinely didn't do in our office so that I don't have to hand type every line item over and over. And then the third way, of course, comes from EMR, where it's what our provider picked that they did during their exam today, and it automatically comes over. So after I do my charges, then I can go into batch. And batch is actually where the claims are batched and sent out from. So I have the ability to do a select all, which would pick every one of my charges that are waiting to get sent out, or I can manually pick one at a time. So if I do have multiple billers in my office, sometimes they want to deal with just their own charges, and so they would actually pick their own and batch their own. I have a validate button here that would actually go out to the Alpha 2 scrubber and scrub using our CCI and NCI edits. Or when I hit batch new, it automatically goes through a validation process. So I only use validate here if I'm worried about something or want to double check on it. Otherwise, it goes through a validation. So when I hit batch, so I don't really need to do that separately. If I have multiple billers, I might throw in a batch and put in my initials behind it, or I can just take the default answer that GloStream gives us and then it knew to batch it. So that claim is now sitting out here in batches waiting to be sent. So all I do is highlight my batch and hit send, and then that information actually gets sent off either electronic or paper, which is a default choice in our insurance file. And then I can say I'm setting, or this is telling me that EDI claim generated successfully. So it's that easy to deal with. I can also highlight it and then look at the CMS form if I want. And so from the CMS form here, you can actually see how the claim was generated and what information it went out as. So it's very easy for you to be able to do any troubleshooting if there is troubleshooting necessary to be done. So posting or batching our claims and sending them out is pretty easy to do as well. The next section would be really finishing up with payment posting. So far I showed you how to collect a copay. If you remember, we right-clicked and went into copay down here. But I also have just a patient payment area, so I can just go into patient payment and say that the patient is paying with a particular check number, and we'll say how much money they're paying. And then just like in charges, I have a close date and payment trays, so I can drive payment trays maybe by, Medicare, commercial, patient mail, daily checkout, that kind of stuff. So you can build, again, your balancing options as much as you want. Earlier I told you to reserve the remaining, but I could certainly come out here and say this $50 payment belongs on this line item and then save that payment. If I hit save, it just keeps me in patient payment, so I could post the next one, but I'm going to go ahead and hit save and close. And then that kind of showed you how I could do patient payment from there. The other thing that I could have done from charges was there was a button there for patient payment. And notice over here it said copay $10. So that's telling me that there's a $10 copay sitting out there that I could post to. And that tells me I can go into use reserves. So when I click on use reserves, it's going to pull up my money and say there's $10 sitting out here. What would you like to do with it? Well, of course, that $10 told me it went to today's date of service on the office visit copay, so I could type in that money and then hit save and close, and I just posted that payment that we pre-collected from that patient. The other option for patient payments is advanced payments. And so advance payments works a lot like copay. I'm collecting money ahead of time for a surgery that they're going to have that the insurance doesn't cover. So maybe I have a $100 payment that I'm collecting every month until they get ready to do their surgery. I can then reserve that remaining just like I did the copay. And then the difference here is it knows it's an advanced pay, and then I could actually say what surgery that they're having done. So we'll just say Botox. And then I could put in the CPT code or the diagnosis, and it would know what surgery was being done or what service was being done that my patient is prepaying for. Or I could have typed it in there. So I can say notes, and now that money is sitting out there in reserves waiting to be posted against those charges that they're paying off. My last payment is my insurance payment. And so what happens with insurance payment is normally we get a big check from a carrier, for example Medicare. So we can just say that Medicare is paying with that check number, and we'll say that they're paying $1,000. So my total funds comes up here as $1,000 for me to get ready to distribute. Doesn't know what insurance it is yet, so I'm not going to pick that for the moment. But I am going to come down here and say what claim number. So our EOBs always come back with what they call patient account number, but really it's our claim number. So we can say that they're paying on claim number 14, and it pulls this information in on the claim. it automatically knew that employer's health plan was the insurance on this patient, so it knew that that was the insurance company it was driven to be paid by. And then on the bottom, it shows you the dates of service that are outstanding for that claim number for me to post against. So I could certainly type in $75 here and then notice that it takes the remaining dollar amount and subtracts that. So if there was a write-off or a difference between the allowed and the write-off, that information would show up there. I could also say if anything was applied to deductible or copay. So let's say that they paid $100 because 25 of it went towards copay. And then here we can say $0. Are you sure you want to post a zero payment in case you're making a mistake? And then I would say that they applied the whole $70. So this is actually easy enough. It follows, most vouchers, so it's not anything surprising. But it's subtracting this big old check as I go. So as soon as I save this, I can then pull up my next patient account and it'll show what happens from there. But before I do that, I want to talk about a couple other things that are out here. Um, it is obviously tracking your new balances as well as your next. What your next button is saying is, what is my next point of action? So am I going to bill this, which because the patient doesn't have a secondary insurance, it knew that it's going to send a bill to self, to the patient. Or if I typed in a rebill, it would know that we're rebilling it back out to the primary insurance information. So I actually have the ability to drive things, however I need to, if I have to rebill something or send it back to the primary while everything else goes off to the secondary. So that kind of gives me individual controls, as well as I have reasons out here. And in the reason area, in a lot of computer systems today, they don't have these pre-built reasons, which are published by Medicare, and everybody uses the same pre-built codes, but they do everything from your co-insurances to deductibles, etc. And you're only seeing 12 because those are the numbers that I plugged in there, but there's the master book of them are out here. And the idea here is that if I have to add another reason code for some reason, I can, but really GloStream has pre-built it to where our charge, allowed, payment, write-off, copay, deductible, co-insurance, and withhold stuff is automatically going with our secondary claims, so that we don't have to hand fill out that stuff. So you probably have to do it by hand manually today, but GloStream has definitely pre-coded that stuff so that you won't have to do that. So it's as easy as that to post our payments. If I hit save and it keeps me on the screen under this check number for me to put in another claim number, I can certainly do that. And what you're seeing at the bottom here is that it's starting to build my EOB. So as I post my payments out here, and I'm just going to kind of show you a few quick and easy things to do. As I'm building this stuff, it's separating my remaining money for me, and then it just takes me into the next one. I'm in the negative over here, and I didn't like that so much. But anyway, the idea is that I can see the EOBs down here, and I can say hide EOB, so I don't have to see that if I don't want to see that. But if I say view EOB, it gives me the ability to look at what was previously posted, and if I made any mistakes, then I know I can come down there and fix those mistakes. So it's a great way to be able to see information that's out there, so, and how our money is being determined. I always forget to talk about this. I want to talk about takebacks for a second as well, and our reserved used. Takebacks are pretty much a big problem when most people are posting payments. The insurance company tends to take money away from a patient, which means that the check you should have gotten today is shorted by money they're taking back from somebody they paid 3 months ago. So you could actually, right in the middle of that EOB, put in your take back amount and it would subtract or re-add that money back into your remaining for you. So you could then reapply it to wherever the voucher is telling you to reapply the money to. If for some reason they didn't tell you who to reapply that money to, then you could use it in your reserved area, and then it'll actually work the same way that patient reserves does. You can pull that money out later on to pay off whoever they tell you to finally pay that money off with. So takebacks are moved right into the EOB. That's something that that other systems don't have, and it's very simple and easy to use. So um, the only other thing about insurance payments is the ERAs, which is our electronic remittance advices. And we do have the ability to do electronic remittance advices, so it'll come in to do in batch or individual posting. So I just don't have that turned on because we don't have real ERAs going out right now, but we do have that ability through Gateway. So I've posted my insurance payments, I got my claims out, did my charges, all that good stuff. So probably the last thing I'm going to talk about is under reports. And so I'm just going to hit on these reports a little bit and talk about some of them. You have your typical daily close reports, which is where it'll pull in your summary reports for charges, for payments, and then your close a day. Um, are prepare for close out here, or are we running an audit, so we can always go back and look at stuff later on even after it's been closed. And so some of the things that I like to see under the daily close area is that we have our starting AR, ending AR, and individual provider ARs as well. So it gives you a day for day look at your accounts receivables. So that's always important to me. Missing charges, if we have a patient checked in that has not been had charges posted against them, then we'll see them. So I'm going to go ahead and do this for a bigger time frame just to make sure that we get some to show up. But these are all charges that I have patients checked in, but we have not posted charges against yet from this date to this date. So some practices worry that, what if my doctor doesn't finish his note? How do I know I have all my charges? And this is really how. It's through your missing charges report. It'll automatically track them for you. You just need to maintain them and take a look. Some of the other things are, typical. I need refund reports, patient balances, transaction histories, cash flows, some recall stuff, your duplicate claims, your patient by date of birth reports. Of course, I jumped in and showed you auditing. Through Gateway, there's all kinds of reports out here as well. So view my reports, list of claims received, staff productivity, claim status reports, claim history tools, and then some claim reviewed stuff. So there's going to be all kinds of things for you to use on a day-to-day basis. And then in our reports, MIS reports, this is where we use crystal reports. And crystal reports actually tie back to our SQL database, which is a database that allows us to report really on any field that has a storage place in it. So our date of birth and all those things are storage places. So I can actually run payment transaction reports. I can do productivity reports by doctor, locations, insurance companies, reimbursement reports with different mix and match options there. We also have the ability to run different agings and other production reports too. And these are just the basics that we've given you out here right now. There is the ability to build mix and match reports through crystal reports like crazy. So you'll see this expanding a lot as time goes on. So, so that's all good. I hope this was helpful, and I will be doing a little more detailed information, although I did get pretty detailed into this one, but things like if I was demonstrating to just the billers and administrators, I would go deeper into the setup of stuff there compared to the physicians. So this was a start, and I hope you enjoyed it. Thank you.